Hello and welcome to all our beloved members of Vaishnavi. Today we have a national level online Otorhinolaryngology Quiz conducted by our quiz master and our own mentor of Vaishnavi, Dr. Tejus. I welcome all the active participants of Vaishnavi and finalists of this particular ENT quiz and quiz master, Dr. Tejus, for this final round of ENT quiz. For the preliminary round, we received overwhelming response of more than 600 participants in a stipulated time period of 6 to 6:20 p.m. That was conducted yesterday. Among them, we received responses from all over India. Even some from many students from abroad also responded. So among them, the best were we have selected 4 contestants. They were the best in the preliminary round. And also we have 2 privileged participants who are also scored well, but we can have only 4 members as finalists. Other 2 will be the privileged participants. If there are any past questions, if there are any questions which cannot be answered by the finalists, then the questions will go to the privileged participants. There will be no scoring for them, but they'll also be equally participating. In fact, they'll be getting the more number of questions than the finalists. So to start with, I would like to introduce all our finalists of this particular quiz. In the first place, we have Dr. Debayan Banerjee, who is currently doing his internship at the prestigious Seth Medical College, Mumbai. Welcome to you, Dr. Debayan.
Very good evening, sir. I'm extremely happy to be here. Looking forward to.
How was the prelims?
The prelims was good. I could not prepare much because of the internship duty. So I'm just looking forward to just revising ENT through this.
No, it more of basic questions were asked, but slightly tricky. They were made into slightly tricky and to test your knowledge. So you could remember all from your what you studied from third year?
It was mostly based on what I studied because I did not have much time to prepare specifically for the quiz. So we'll see.
How do you gauge the level of questions? Easy, medium, hard?
The questions were medium, but I had forgotten some things. So so in that way,
no. In fact, that should boost your confidence much more. Even after forgetting everything and without preparation, you have stood first in such a big quiz. If you had studied, what would be your condition? Just imagine. Okay, so that should in fact boost your confidence much more. So well done, Dr. Debayan. So all the best to you for the finals.
Thank you, sir.
In the second place, we have yet another candidate from the Seth Medical College, Mr. Omesh, who is a 4th year medical student. Welcome to you, Mr. Omesh.
Hello, sir.
Hi, Omesh. How was the prelims?
Sir, it was good, sir. Actually, sir, I had recently completed 3rd year, so
you're fresh.
It went well, yes. But still, I forgot many things because our exam was 3-4 months ago, so and I am preparing for final year, so.
Correct. No, anyway, you have scored really well. And you answered brilliantly. Okay, so well done. Continue the same in your this final round also. Okay.
Yes, sir.
And the third place we have whether Vaishnavi has joined us? No, right? So then actually Vaishnavi from KIMS Bengaluru was our third finalist, but due to some reason she is not able to join us. So Dr. Dewang Agarwal from AIIMS Rishikesh will be our third finalist. Welcome to you, Dr. Dewang.
Good evening, sir. Thank you for providing me the platform.
Yeah.
Yes, sir.
Prelims?
So prelims are actually good. Like the questions are tricky. So if you are in a hurry and if you miss one line, you're going to get it wrong. So the questions are like that.
In fact, it was a perfect preparation for your upcoming PG examination. We have kept it in such a way that the questions were made how the examiners would ask in any entrance exam, the similar okay. So yes, you have done really well and you have scored maximum in the preliminary round. Congratulations for that and looking the same performance in the finals as well. Okay.
Thank you.
And in the fourth place, we have Miss Riya Gohil, who is a 4th year medical student at Baroda Medical College. Congratulations and welcome to Miss Riya.
Thank you, sir.
Yeah. And as our privileged participant today, we have Dr. Rohini Nannaware, who is doing her internship at Tejus Medical College, Mumbai. Welcome to you, Dr. Rohini.
Good evening, sir. Thank you so much.
Yeah. Our quiz masters for today's doesn't require any introduction. Most of you have seen his classes, and previously also he has conducted very famous radiology and pathology quizzes. Very passionate. He was my junior as well in Bangalore Medical College, and also our badminton team partner as well. Such a good all-rounder. He's good in academics, all the extracurricular activities. Dr. Tejus S M, he himself volunteered to conduct. When I requested Tejas, he is also doing his very heavy, hectic senior residency. Even then, he has taken all the efforts to conduct this quiz to help his juniors out there. I'm very sure this quiz is going to be not just checking your knowledge, but in fact, through each question, we are trying to give you some basic ideas of ENT. Anyone watches this quiz will get basic all the concepts clear, and also it will be good revision for those who are preparing for your entrance exams. This is through this quiz, we have made sure that the entire ENT subject is covered through each and every questions, and we will take home some message via each question. This is not, remember, this is not your testing your knowledge. In fact, this quiz is particular to boost your confidence and morale. Is it clear? So don't consider this as a competition wherein we check your knowledge and all. No. Unlike all other quizzes, our White Army EPIGNOSIS is mainly to build the confidence among our members. So take it very positively and try to revise the entire subject through this quiz. Over to you, Quiz Master Tejas.
Good evening, everyone. Good evening, sir. Thank you for that wonderful introduction. Like Kishan sir already said, this quiz is not going to test any one of your knowledge. More than knowledge, it's going to test your tempo. So basically, recently giving all the competitive exams like NEET, INI, CET, I have realized one thing, that more than knowledge, the temperament with which you go to an exam is what matters the most. And more than a subject approach, we should have a holistic approach towards any topic given. So here, more than just seeing ENT as a subject, I have tried to inculcate ENT as a holistic approach. Like suppose, for example, if a patient comes to you, you're not going to see the patient as an ENT patient or a surgery patient or a medicine patient. You'll have to treat a patient as a patient. So I've tried to inculcate most of the clinical acumen given. Before starting the quiz, I would like to thank Dr. Kishan Rao sir and the other core members of White Army for giving me this opportunity to learn and share my knowledge with everyone. So I've tried to make this quiz as fun as possible. So in between, if you have any doubts, you can put a message on the White Army group or the Telegram group or the WhatsApp group. So without any further delay, let's get going with the quiz.
One request from my side to all the audience: don't prompt with the answers in the chat section. Okay, when there are separate questions which will be asked to the audience only, that time you can post the answers in chat section. I'm not going to log the chats, but please hope you'll understand. Okay, don't prompt, because it will be a partiality from our side if you just keep prompting one or other two members. Is it okay, Dr. Tejas?
Yes, sir. Yes, sir. Please.
When there are particular question asked to the audience, that time you can post them in chat section.
Yeah. So if the questions are not being answered by the contestants, it will be passed on to the privileged participants first, and if they are also not able to answer, then it will be open for all the audience. So kindly answer when the question is open for the audience, please. So without any further delay, let's start with our round one. Round one is a round of choices. So each question can be answered without the help of options also. So if answered without the help of options, you will be awarded 20 points. If answered with the help of options, you'll be awarded 10 points. And each question will have a bonus question of 5 points. Remember that if you answer the question without the options, and if it's wrong, you're not going to get the options. The question will be passed. So before answering, think twice. There are no negative in this round, but there'll be a time limit of 45 seconds per question. So keep the time limit in the head and choose your choices wisely. So, Dr. Debayan, are you ready for your first question?
Yes, sir.
Yeah. So here it goes. A 20-year-old male came to ophthalmology OPD with complaints of retroorbital pain and double vision since 5 days. Patient also has fever and headache since 5 days. He was later referred to ENT department due to history of decreased hearing from right ear and discharge from right ear, which aggravated on upper respiratory tract infections since he was 5 years old. Identify the specific condition of the patient. Your time starts now. You have 45 seconds on the clock, including the options. So if you want the options, you can unlock the options.
I want the options, please.
Yeah, here you go.
Can you go back to the question, please, once?
Yeah, sure.
Okay. I'm ready for the answer. The answer is petrositis, option B.
Why do you think it's petrositis? Can you please elaborate your answer?
Because there is ear discharge and diplopia and headache, which is a triad, Gradinigo's triad of petrositis.
Can you tell what is the Gradinigo triad, please?
The Gradinigo triad is diplopia, retroorbital pain, and persistent otorrhea.
Uh, you're almost right. Actually, it is Gradinigo syndrome will be persistent otorrhea, fifth nerve palsy, and sixth nerve palsy. So fifth nerve palsy will lead to retroorbital pain and facial pain,
Yes.
and facial numbness also. And sixth nerve palsy is going to cause diplopia because it's going to supply the sixth lateral rectus muscle. Are you ready for your bonus question?
Yes, sir.
Yeah. So the bonus question goes like this. Name the bony canal through which sixth nerve passes through during its intradural course.
The Dorellos canal.
Very good, though, and that was actually actually quite impressed. Can you please tell me the sixth nerve course? And because it's right, the longest intracranial course of any cranial nerve is sixth nerve.
Yes.
So can you tell me the course of sixth nerve?
So the sixth nerve basically arises at the pontomedullary junction.
Pontomedullary junction. Are you sure?
As far as I can remember.
Okay.
And, course in the sense I'm not able to remember the exact structures. It has a long
That's okay.
intracranial course and
Okay.
supplies the lateral rectus. And it passes
Okay.
through the cavernous sinus also.
Yeah. In cavernous sinus, can you tell me what is the relation of the sixth nerve?
It is antero-inferior in relation to the carotid artery.
Okay. And this is important because in case of internal carotid artery aneurysms, sometimes in big aneurysms, the first symptom will be diplopia. Patient will come to us with diplopia, and we'll have no idea that patient was actually not having an eye problem, but is actually having a aneurysm in his internal carotid artery. Dr. Rohini, our privileged participant, a question for you. Can you tell me where does the six now enter the orbit to supply which extraocular muscle?
So superior orbital fissure to lateral rectus.
Okay, in superior, yeah, when while entering the superior orbital fissure, it will actually enter through the common tendinous ring. Okay,
Yes.
wonderful. So that will be a total of 10 points for 10 plus 5, 15 points for Debayan. So let's move to our next question. To our next participant, is Mr. Omesh ready?
Yes, sir.
Yeah. So the question goes like this: a 30-year-old male came to the casualty with complaints of severe headache, severe neck pain, and neck rigidity with high-grade fever since previous night. On examination, Kernig sign and Brudzinski signs were negative. His wife tells that he was suffering from throat pain since 3 days, for which he took medications from an Ayurvedic doctor, but the pain didn't subside. Identify the condition of the patient. You can use the help of the radiological image. Your time starts now. You can unlock the options if you want.
Sir, I want options, sir.
Yeah. Option A, Lemire syndrome. B, viral meningitis. C, bacterial meningitis. D, Lerich syndrome.
Sir, question please one more.
Yeah, sure. You have last 15 seconds.
Sir, option A, Lemire syndrome, I think.
What is Lamar syndrome, Doctor? I mean, Mr. Umesh. Can you tell me what is Lamar syndrome?
Sir, actually, I have eliminated the B and C and I have given 50-50 as option A and B.
Okay. This is the reason I actually kept this question because I think sometimes in our NEET or any competitive exams, most of the time we won't know the answer. So I think this was a very smart move by Umesh. This skill of coming to an answer by omitting the other option is very, very important. So, Umesh, can you tell me why did you think that it's not C or D?
Uh, Sir, actually, in the image we can see, I think there is some abscess uh, around the trachea. So and Kernick sign and Brzezinski signs are negative, so that means there is no meningitis.
Okay.
So
Why was it A
D,
and B then? What is D? What is Lerich syndrome? Do you know what Lerich syndrome is?
sir, I forgot that.
Dr. Rohini Nannaware, would you like to answer?
Sir, Lorentz syndrome is basically saddle embolus at the aorta, which will cause bilateral palsy at the both, bilateral paralysis at both the lower limbs, and
Paralysis?
um, so both lower limbs will be affected in Lorentz syndrome due to saddle embolus at the aorta bifurcation.
Does anyone else want to answer this question? Any other participant? What
This
is
is
Lerich syndrome?
aortoiliac. Basically, the aortoiliac, there is an obstruction of thrombus because of which there is ischemia in the lower limbs. Then there is gluteal.
May I know who is this answering?
Dewang Agarwal.
Okay. Devang, you either tell your name and answer or you switch on the video, please. Okay.
Oh,
Yeah,
okay,
please
sir.
continue. Yeah,
Sir.
continue.
So basically, in aortoiliac disease, it's basically an ischemia condition of the lower limbs. So there will be
Okay.
gluteal claudicating pain,
Okay.
and there's a thrombus or atherosclerosis or stenosis of the artery in the aortoiliac region. So there will be bilateral lower limb which will be affected.
Okay. And one important,
Along with it, another important feature.
yeah, one important feature,
Varices.
especially males will come
Yes.
to you with this.
Impotency.
Yeah.
Not
So
infertility, it's impotence.
impotency. It's not infertility, impotency. Very, very big problem. So coming back to the question, Lemire syndrome. Does anyone want to answer what Lemire syndrome is? No one gave me the answer what Lemire syndrome is. Anyone?
It is thrombophlebitis of the
Septic
cervical,
thrombus
septic thrombophlebitis.
of the
Of the,
IgV.
yeah, of the IJV. So as you can see in this image given,
Excellent.
the IJV which is seen next to trachea, and because of thrombosis, you can see this sign on CT scan with contrast. And very, very important clinical feature which will project towards the Lemire syndrome is that the patient is having sore throat since 3 days. So basically, a tonsillitis, especially caused by Fusobacterium, will, if not treated at the right time, will lead to extensive disease, and the infection can spread through the bed. And if it goes and spreads to the internal jugular vein, then it's going to cause a bacterial thrombophlebitis and a thrombus, which will lead to um, severe neck rigidity and high fever. I think any thrombophlebitis, very, very important feature will be high fever. Patient will going to come with high grade fever. I think more clinical features projecting towards Lemire syndrome will be the sore throat, the feature of sore throat, and the neck rigidity. Okay, so are you ready to answer your bonus question, Omesh?
Yes, sir.
Yeah. So this is your bonus question. Name at least 5 structures forming the bed of tonsil. I think this is the most important question for any UG.
Sir, uh, the fascia covering the tonsil, superior constrictor,
Okay.
masseter, angle of mandible, medial pterygoid.
Okay. So do you want to name the others also? There are 10 structures if you remember.
Sir, styloid process and the
So
muscle
what is
attached
that
to the.
fascia? What is that fascia? Now can you see and tell me what is it? I think I've taken this class already. People who have seen my class will know the bed of tonsil.
Yes,
So
sir,
there are
pharynx.
10 important structures. The capsule covering the tonsil at the lateral bed. The green color you can see is lateral, the capsule. Then you're going to have loose areolar tissue area, which has a paratonsillar vein. In during tonsillectomy, if you have seen any tonsillectomy procedure in your ENT OTs, you'll know that the most common cause of hemorrhage in tonsillectomy will be a bleed from paratonsillar vein. It's not a arterial bleed, but it's a venous bleed. And then you're going to have pharyngobasilar fascia, then superior constrictor muscle, then buccopharyngeal fascia, then you have glossopharyngeal now, ninth now, very important now, which supplies the oropharynx. Then you have facial artery, you have the submandibular gland, then you have medial pterygoid, then you have angle of mandible, and then you have the masseter muscle. Okay, so that will be 15 points for Mr. Omesh. Next question will be for Dr. Dewang. Are you ready, Dr. Dewang?
Yes, sir.
Yeah. So a 58-year-old male came to ENT UPD with complaints of right-sided facial pain and nasal regurgitation of fluids since 2 to 3 weeks. On detailed examination, it was found that the Weber's is lateralized to the right ear. Identify the syndrome or the disease associated. The time has been started.
I will like to answer. This is most probably the person is having. Okay. The
Before you
person is
answer,
having nasopharyngeal carcinoma. This is a trotter striate.
okay, okay, wonderful. Okay, wonderful. Can you tell me what is rotor striate?
So basically, trotter striate, there is conductive hearing loss because nasopharyngeal. What I'm saying, the nasopharyngeal cancer is just at the fossa of Rosenmuller. So it's going to
Okay,
obstruct the eustachian tube. That's going to cause a CHL. After that,
okay,
when it starts to invade, it's going to go into the. It's going to invade the male structures. After it affects the male structure, it's going to cause a fifth nerve palsy, and also the seventh nerve is around it, so it's going to cause that palsy also. So there will be seventh nerve palsy in facial pain, and then because of ninth and tenth nerve injury, there will be regurgitation of food from the nasal palate. From the fifth nerve injury, a V3 nerve will be affected, the mandibular branch, and then there will be conductive hearing loss.
you missed 1 point. You told almost everything right, but that's not. But it's okay. Let's come back to this question after your bonus question. Are you ready for your bonus question?
Okay, sir. Okay.
Yeah. So, what are the contents of sinus of Morgagni?
So in sinus and Mumbai, we have a TALA structures. We have the eustachian tube. We have the tonsil branch of facial artery. We have the palate, tensor valley palatine muscle. And sometimes we can also see the levator valley palatine muscles.
You are half correct about the contents.
Uh,
Facial doesn't go. So you have answered this the contents wrong. So the question goes to Rohini. Rohini, would you like to take a try of this answer? What are the contents of sinus of Morgagni? A question from my class.
Yes, no. The contents are tensor vena palatini, ascending palatine branch of the ascending pharyngeal artery, then
Okay.
levator vena palatini,
Okay.
auditory tube, and there's one more artery. So,
Yeah. What is the artery?
palatine branch
Of?
um,
It's ascending palatine artery. It's pharyngeal branch. See, so you're almost correct. Like you already told, most important content will be eustachian tube. Then there will be tensor veli palatini and levator veli palatini muscles, and there will be pharyngeal branch of ascending palatine artery. So there is palatine branch of ascending pharyngeal artery and pharyngeal branch of ascending palatine artery. There is no branch of facial artery, Dr. Devang.
okay, sir.
And one more point you missed in Trotter's triad will be that it is actually, like you already told, there is fifth now compression which causing the facial pain, and like you was precisely told, it's the mandibular branch of fifth now. You'll have like you already told, conductive hearing loss because of,
The
again,
palatal pulse. Yes, sir.
yeah. So, and you'll have palatal palsy because it's
Yes, sir. Palatal
compressing
pulse.
on the levator veli palatine muscle. Okay.
Yes, sir.
So yeah. So basically, when the tumor breaches the sinus of Morgagni, what is sinus of Morgagni? The sinus of Morgagni is basically just the space between the base of the skull and your superior constrictor. This space is covered only by fascia. The fascia, the green color you can see, which is the pharyngobasal fascia and the buccopharyngeal fascia. They join above these muscle to form one layer covering around the sinus of organgly. So it is very easily breachable because this is only covered by two layers of fascia. Okay, so that is 20 points to Dewang, which you answered Stotter syndrome. Very good, very impressed. So the last question of this round, Dr. Ria, are you ready?
Yes, sir. I'm ready.
Yeah. So the question goes like this. A 8-year-old male child was diagnosed with cleft palate with bifid uvula and was planned for uvulopalatopharyngoplasty. 4 hours post-operatively, the mother anxiously reports to surgeons saying that the patient is complaining of severe neck pain and inability to move the neck. Identify the condition. The patient is basically
Uh,
like this.
okay.
Your time has been
So
started.
this is uh, Grisel syndrome,
Okay.
and it is due to subluxation of the atlantoaxial joint that has led to the paracervical muscle spasm.
Okay. Well, can you please tell me what is this position called? You already received 20 points. What is this position of the boy? There's a specific name for this position.
Mm, Sir, I don't remember the name of position.
Uh,
Uh,
can anyone else tell me the? What about Rohini? Rohini, do you want to take a try on this? What is the position of the child?
No, sir. No, sir. No idea.
Okay. Anyone else? Any participants? Yeah. I think KP already answered the question. The position is called cock robin position. Basically, it's because of overextension in rose position. So rose position is basically extension at the neck and head joint. So head joint is nothing but atlantoaxial joint and cervicothoracic joint. There's extension in both of these positions. This is called rose position. If there's overextension, that will lead to atlantoaxial subluxation. So these were the basically the options. So like she already told, this is the Grisel syndrome, which is option B, atlantoaxial subluxation. Um, can someone tell me what is Gradinego syndrome? I think we already discussed Gradinego syndrome. Gressinger sign. Can someone tell me what is Gressinger sign? Anyone? There's actually no Gressinger syndrome. I just added it because it sounded fancy. But there's Gressinger sign. Can anyone tell me
So
what is?
basically, when there is in mastocytitis, it's a complication. So
Mhm.
basically, the veins over the mastoid they get engorged, and there is edema over mastoid. So that sign is the smoothening and edematous mastoid is
It's not
called as
actually, you're right about the finding, but it's not because of mastoiditis. Do you find it in all mastoiditis, Devang?
not mastoiditis. Basically, it's a complication of our CSOM. So there
What
is a
complication? What complication?
lateral
What is?
sinus
IJB thrombosis,
thrombophlebitis.
IJB
Yeah, it's lateral sinus thrombosis, not IJB.
thrombosis.
It's
It's a
lateral
lateral
sinus
sinus.
thrombosis. Yeah. Okay. Ria, are you ready to answer your bonus question?
Yes, sir.
Yeah. So bonus question goes like this: give me at least three contraindications of tonsillectomy.
Um, Acute tonsillitis.
Okay.
Uh, then patient is having a bleeding diastasis,
Okay.
and if patient has poliomyelitis.
Okay. It's not exactly if patient has poliomyelitis, but you would not do it in a
Endemic region.
Yeah, you should never do it in a polio
Yeah.
endemic or epidemic regions. Can you tell me why? Why you can't do it in a polio endemic?
Um,
Can
it
you
will already
uh,
lower the immunity in that case.
see if that's the case? You're not supposed to do it in any kid because all kids are
Yeah.
will become low in immunity.
Yes,
But
and the
if you can't do it,
poliovirus,
yeah.
poliovirus, I have read that the path through which it travels is through the glossopharyngeal nerve. So if we remove the tonsils, the glossopharyngeal nerve will be more exposed as compared to the previous state. So it can easily cause infection.
Not exactly, but it is because when you remove tonsil, basically this polio virus will be predominantly in all the lymphoid tissues like gut lymphoid tissue, in upper respiratory tract in Walde's ring. So when you're going to remove the tonsil, it's going to have a easy way through it through the blood. It's not glossopharyngeal now exactly, but it can easily cause this sepsis of the virus. So Ria, you're going to get 25 points. So congratulations on that. So this is the end of round one. So I think all the participants have got one question each. So scores at the end of round one. Deban has 15 points. Omesh has 15 points. Dewang has 20 points, and Riya has 25 points. So without any further delay, let's go to round two. So round two is called Master Chef. So basically, there are two sets of questions. First set will be where you're it's basically questions on procedures. So first set is going to be what are the instruments you can pick from the procedure, and mind it, if you're going to pick a wrong instrument, you're going to have negatives. Okay, -2 for every wrong instrument you choose. So second set will be arranging the steps in correct order. So you'll have a total of 1 minute to do both the sets. So you can take as many as time for first set and as many as time for second set, but just mind you, there are just one whole minute for both the sets together. And a question can be passed if the participant gets the first set wrong. So do you have any doubts, or can we go to the first question?
Sir, if we want to like avoid the negative, can we skip the question? Like if we are not exactly getting,
Yeah, you can skip the question.
we can skip the question. Okay,
You
thank
can,
you.
if you skip the question, if we will go to the next. But you can't skip the question once you've
Answered
answered
it.
it.
Okay,
Yeah,
okay,
yeah.
sir. Okay, okay, okay.
Okay. So I'm going to jumble up the participants here based on the scores. So the first to go will be Dr. Debayan. Are you ready?
Yes, sir.
Yeah. This is just a sample question. Don't worry. So basically, just to make you understand. So if I'm going to tell you how to make a Maggie, what are you going to choose? Obviously, you're going to choose one, and to also help you with the numbering. So numbering will be 1, 2, 3, 4, 5, 6, left to right in both the rows. Okay, 1, 2, 3, 4, 5, 6. So for making a Maggie, I would choose 1, 3, 4, and 5. Obviously, I wouldn't need a toaster or Coke to make a Maggie. And the next would be arranging this. Add Maggie masala and stir. Keep the pan on burning flame. So if I'm going to arrange it, it will be 2, 4, 5, 1, 3. So I hope you have a pen and paper next to you so that it's going to help you better. So, Dr. Deban, are you ready? Did you
Yes,
get the
sir.
gist of the round? How it's going to go?
Yes, sir.
Okay. So, please give me the steps of tonsillectomy. First, give me the instruments you're going to use for tonsillectomy and then the steps. If time has been started, you have 1 whole minute for both the sets. This is your set one. So, basically, this is 1, 2, 3, 4, 5, 6.
Sir, can I have to answer before I go to the next question, right?
Yeah. What are all going instruments you're going to pick
So,
from this set?
so I will pick instruments 2, 3, 4, and 6.
Okay. So you've got the first set correct. So you can go to the next set. You have 40 seconds left. Twenty seconds. Five, four.
Yes, sir. Yeah, I'm
Yeah,
ready.
yeah.
6,
You have
1,
one.
3, 2, 5.
Did you miss a number?
4, 6, 1, 3, 2, and 5.
Yeah, I'm so sorry, Debayan. Because it's time constrained, I can only consider your first answer as 61325.
I think he told first and then we could not hear something like that.
Sir, I told 4, 4, 6, 1,
He
3.
told we could not hear.
Okay, okay, okay. So that is actually right answer. 461325 is the right answer. So you're going to get the whole 10 points for this round. So 10 points are awarded to Deban. I hope other participants are well aware of the
One doubt, is it 10 plus 10 or 10 for the total 2 questions?
No, 10 for the total 2 questions.
Okay, thank you.
Okay. Yeah. So the next question is for Omesh. Sorry, Dr. Riya. Are you ready, Dr. Riya?
Yes, sir.
Yeah. So the next question will be for you, and the time will start as soon as the slide is put. Okay.
Okay.
Yeah. Tell me the steps for tympanoplasty. First, instruments. You're going to pick the instruments which are you going to use. Then you're going to give me the 10 seconds.
Tympanoplasty. Uh, 4 and 6.
You're just going to use 4 and 6.
Yes.
Uh,
And
so,
and 5. And 5. 4, 5, 6.
so because you've answered the question wrong, Riya. So this question will be passed on to Rohini. Rohini, do you want to take the answer? Do you want to take a try? What are the instruments you're going to use?
So is it 4 and 5?
No. Anyone else?
Sir,
Yeah.
Dewang here.
Yeah.
1, 4, and 1, 4, 5, 6. 1, 4, 5, 6.
I think Dr. Adishesh answered the question already. I don't know why you guys are not using two. Do you know what is two? Two is one of the most important instruments used in tympanoplasty. You guys are good that you excluded three. It's quite obvious, but why not two? Two is called crocodile forceps, and it's one of the most important instruments. So, Dr. Ria, you still can answer the second set, but you won't get a score. Would you like to take a try?
Okay, sir.
Yeah. So, would you like to take a try on this?
Yes, sir.
Yeah, sure. Go ahead. Because you're running short of time, instead of doing the steps, I'm going to take a class soon on this because just projecting question on the screen won't help us understand how a tympanoplasty is done. Let's just revise little things about tympanoplasty. Dr. Ria, can you tell me why is the step 6 done? Why are margins freshened? You have a perforation on the TM. Before placing the graft, why do you want to freshen the margins? Before that, I'll just give you an answer. Sorry to interrupt, Dr. Yeah. So the step 1 will be post-oral incision taken. So the name of the post-oral incision is William Wild incision. Step 2 will be temporalis fascia graft harvested. Step 3 will be posterior myotomy done. That is, you're going to posteriorly, you're going to enter the middle ear cavity by making a hole through the EAC, posterior wall of EAC. That is what is posterior myotomy. Posterior myotomy is nothing but making a hole through the posterior wall of EAC. Then will be step number 6, margins of perforation freshened and undermined. Then will be step number 7, tympanomeatal flap raised. Then next will be step number 3, graft will be placed over the handle of malleus covering the perforation. Then will be step number 8, tympanomeatal flap reposited, and last will be hemostasis achieved and layer sutured. So I'm soon going to take a class on this. Just answer me this one question: why do you want to freshen the margins, Dr. Ria? You have any idea?
No, sir, I have no idea about it.
Anyone else? Why do you want to freshen the margins of perforation before you place the graft? Anyone else can answer?
Sir, margin can get epithelialized, so I think
Yeah, that's true. So margin is actually not see, basically, tympanic membrane has 3 layers, like you already know: the outer epithelium, middle fibrous layer, and inner squamous epithelial layer. Okay, so basically, the any perforation is going to get healed on its own. The only reason it's not getting healed is because the margins are epithelialized, like you told. So you have to clear the epithelialized layer so you can create fresh margins. And fresh margins means you're going to uh, what can stimulate the cells to produce growth factors. So it will help the perforation to be joined with the graft you're going to put. So other steps I'm going to discuss in detail soon. I'm going to take a class on tympanoplasty, types of tympanoplasty. So because of time constraint, I'm going to move to the next question. Next question will be to Mr. Omesh. Are you ready?
Yes, sir.
Yeah. So give me the steps. First, identify the instruments for adenoidectomy and give me the steps. Time starts now. What are you going to you're going to pick from the given tray? It's 20 seconds.
Sir, 3, 4, and 5.
Okay, that's correct. So you can go to the next one.
Okay.
You have last 15 seconds.
Oh. Sir, 2, 1, 4, and 3.
Okay, so that's actually correct. So you're going to be awarded a score of 10 points. So Mr. Ramesh gets 10 points. Can you just tell me why did you pick the 1, 3, and 6? Do you know the answer for this? What is 1, what is 2, and what is 6? Why didn't you pick 1, 2, 6?
Sir, 2 is, I think, scalpel blade, and so we don't use that one.
Okay,
And fifth one is use tonsillar snare, so it is used in tonsillectomy.
okay, very good. And what is 1? Anyone?
Sir, one I don't have any idea, but it is not used in vaginal.
Okay, good guess. Anyone else? What is 1? Anyways, we'll come back to 1. Good that no one answered that. We'll come back to 1 later. No, it's not actually Mollison's anti-tonsillar, antipillar and retractor and tonsillar dissector. It's not the right answer. I'll come back to 1 later. Okay. So the last question for this round is for Dr. Dewang. Are you ready, Dr. Dewang?
Yes, sir. Yes, sir.
Yeah. Here you go. Please give me instruments for tracheostomy.
Okay.
Time has started now.
We need the instrument 1, we need the instrument 3, we need the instrument 6, and we need 2.
Can you repeat? 1, 2,
1,
3,
2,
6.
3, 6.
Are you sure? Can I take this as an answer?
1 minute.
You
We
have
definitely
30 seconds. You have 30 seconds left.
okay. We need 2, 3, and 6 definitively.
2, 3, and 6.
That is what I can remember. Yeah. I'll quote
You
the
have
book.
last 15 seconds. Do you want to pick any other instrument to perform the procedure?
Uh, Not exactly sure. So 236 is the best. Like what I'm getting 1, 2, 3, 6. But
I think your time is up because you couldn't pick all the instruments. You can't go to the procedure. I'm sorry, Dr. Devang.
okay.
Anyone else? Anyone else want to give a try? Anyone else? Yeah, Dr. Adishesh Kaul is right again. You need everything except phi. I think only phi is not used because phi is used in ear surgeries. So you need scalpel. You need a second. What is the second instrument, Devang? Because I'm not going to discuss tracheostomy instruments again. I think it's
That was
better.
dilator. So that's been
Yeah.
good.
What is 3, Devang?
That's the cricoid book.
Okay, very good. What is 4?
4 is just like that's going to help in retract skin, etc. And that's
It's an artery forceps.
artificial, yeah, basically.
Yeah. What do you use artery forceps in tracheostomy, Devang?
When like if Even I'm confused. Like we use it for retract, like melting
We use
retractable.
it to dissect planes in
Dissect the
basically
plane.
any surgeries. You can use it, and tracheostomy though it's one of the most important instruments. And what is phi? Anyone? What is this phi? It's the mastoid retractor. Uh, anyone knows the name of this mastoid retractor can put it in the chat box. It's a question for the audience. And what is 6, Devang?
So that's a tracheostomy tube. That's
Yeah.
a tube.
So do you want to take a try on the steps? Devang, you're not going to be awarded any marks for this.
Okay, we'll try.
Yeah, sure. Go ahead.
So first we're going to do two. Then we're going to do one.
Okay.
Then we're going to do uh, seven. Then we're going to do
7.
no, he was achieve it. Okay, sorry. The skin. Okay, then we're going to first three. We are going to retract all the layer until
Okay.
thyroid three. Then we're going to
Okay.
do five. Thyroid
Okay.
gland will be retracted. Then we will
Okay.
do four incision over the trachea. Then hemostasis, and then tracheostomy two inserted.
You're almost right, but I think hemostasis is done after the tracheostomy tube is inserted. Okay.
Okay. Okay.
Once you insert the remember in any surgery, hemostasis will be the last to achieve. But if there is extensive bleeding, obviously, yeah, as in hemostasis as a whole is done in the end. Minor hemostasis like cauterizing artery is done everywhere, but checking hemostasis and hemostasis achieved as such, if it's an option in the question, that should be the last always. So this is the end of round two. So at the end of round two, scores will be, just give me a moment. Yeah, Dr. Debayan is at 25, Mr. Omesh is at 25, Dr. Dewang is at 20, and Dr. Riya is at 25. So it's a close call. So let's move to the next round, my favorite round. It's called Hum Saath Saath Hai. Kishan sir is there. I would like him to take a try on for first question.
Yeah, I'm very much there. It's
Sir,
going really well, but
it's,
I'm
please,
not
this is a
prepared
round
in
of
any way.
connecting the dots.
Okay.
So each right answer will carry 10 points and each wrong answer will cost a negative of 5 points. There's no passes. So this is the first question for Dr. Kishan sir.
Mhm.
Would you like to connect the dots and find the common factor? It's just a sample question so that contestants can.
What should you do? Sorry, I didn't get.
So just connect the dots and what is the,
Okay. Correlate all four and
yeah, give me one
tell
answer.
what is that.
Yes, sir. Just a sample question.
India is the capital of IHD something.
No, sir.
Some disease you're asking here?
No, sir. It's just a trivial thing. It's not related to medicine. A clue.
I will pass to Debayan. He will answer on my behalf. Debayan, please help me.
Pass, sir.
Huh? Debayan is also pass. Then nobody can answer this. Rohini, can you help me?
No, sir, can't get it.
Hey, don't tell me like that, please. It's if not
Anyone
available,
in the
then I'll go
audience?
with Dr. Kaul. Kaul will definitely help me.
This is
Kaul?
related to recent happenings in cricket. To be more, give more hints.
RCB.
Why do you think it's RCB?
Okay, it
1%
was
chance of
dying.
qualification.
Yeah, and they always win by giving us heart attacks. And this is Bangalore, and
Okay.
so
Nice.
I hope you guys got a gist of this round, how it's supposed to be approached. This is just a fun question. So are you guys ready? Let's start with Dr. Riya this time. Dr. Riya, are you ready for your first question?
Yes, sir.
Yeah. So the first question go up. Before going further, I would like you to take a look on the negative. There's a negative if you answer the question wrong. And I forgot to mention you have 40 seconds to answer this question. Okay.
Sir, if I am not able to answer, what should I do?
No, you don't need to. If you can pass it, it will go to the audience. There's no, I mean, there's no passes to the other contestant, but you can just choose not to answer. But if you answer, it will be negative points. And make sure you give one answer. I'm going to just consider the first answer you're going to tell. Okay. You can't change answer once told.
Yeah.
And you have 40 seconds once the slide is put. Okay.
Yes, sir.
Yeah. Are you ready?
Yes, sir.
So yeah, here it goes. And sorry to interrupt. The points will be awarded if you are going to tell me, give me the exact reason behind every photo. For example, 1% will be 1% chance that the RCB had for playoffs. The second one, heart attack. Obviously, it's always a thriller match. Third is a photo of Bangalore, and fourth is they have one name Royal Challengers Bangalore. So you have to give me reasons for all the four photos. You can't relate between just one or two photos. You get it?
Yes, sir.
Yeah. Points will be awarded full score, or if awarded only if all four is decoded. Okay. Yeah.
Okay, sir.
Here you go.
Okay. Anosclerosis. Um,
You have 20 seconds.
um, okay, sir, I would like to answer.
Yeah, yeah, go ahead.
Sir, by connecting all the dots, we can see that it is autosclerosis.
Okay, very good.
And first image shows pregnancy, which means
Hmm.
that it is seen in females pregnant. Means after pregnancy or during pregnancy, it can occur. It is one
Okay,
of the risk factor.
very
Then
good.
second is the PTA,
Hmm.
wherein the bone conduction is normal, but there is a notch at 2000 hertz, which is known as
Hmm.
Hart's notch.
Very good. Okay.
Um,
Third and fourth photos.
uh, the tympanic membrane shows um, hue because of sclerosis of the foot plate,
And that's
and
good.
uh, and the fourth is the histopathological slide, which shows the blue mental cells.
Okay, everything is fine, but you have to give me the sign, name of the sign in the third photo.
Um, mm, Sh-
You don't know?
Schwartz sign.
Yeah. So very nice, very impressed. So Ria, you're awarded a score of 10 points. That's correct. So the first photo tells that autosclerosis is predominantly seen in pregnant females, and pregnancy is a triggering factor. If you have um, the gene for it, then you're going to get a in pregnancy. It's going to get aggravated during the pregnancy, and the patient is going to present to us during pregnancy. Dip in the bone conduction uh, in 2000 hertz is specifically seen in autosclerosis, and you already told, it's called Cahart's notch. And the third one, it's called Flamingo pink sign or Schwartz sign. It's basically because of the sclerosis of the tympanic membrane. And last, it's the blue mantles histopathology. It's basically a spongiform osteocytes, newly forming osteocytes because of sclerosis, which is going to give you this sign. So very great, a great attempt, Dr. Ria. Uh, Dr. Rohini, would you like to take a question here? What would be the Rene and Weber test for this patient?
So Rennie's will show bone conduction greater than air conduction, and Weber's will be lateralized to the same side.
Okay, very nice. So that is there. So because autosclerosis is a type of conductive hearing loss, the Rene's test will be negative, that is bone conduction more than air conduction, and Weber's test will be lateralized to the same ear because it's conductive hearing loss. Okay. Can anyone tell me the inheritance pattern for otosclerosis? Well, I'm going to ask you this again in the end of the session. So, second question. Second question will be for Dr. Dewang. Are you ready, Dr. Dewang?
Yes, sir.
Yeah. So once the photos are put, 40 seconds on the clock. Okay.
Sir, I would like to answer. This
Yeah.
is the papillary thyroid carcinoma. So one
Okay.
Chernobyl accident, because of the radiation, like lots of soot was released, and that Chernobyl area had an increased risk of papillary thyroid carcinoma.
Okay.
In the fourth slide, we can see the histological feature, the orphan ani nuclei, the molding of the nuclei, etc., which are a feature of papillary thyroid carcinoma.
Okay.
Third, most likely shows the gross goiter or gross mass when we are doing the examination.
Okay.
Second, I'm not sure what second is the female. Maybe she was a case of this papillary thyroid carcinoma. I'm not exactly sure. Maybe she was a case. No, I don't personally know.
Okay. Just by seeing relating papillary carcinoma thyroid with females, what do you want to give a gist? Like, how are females and papillary carcinoma thyroid related?
Basically, they have the iodine by that. No, Hashimoto, because of that.
No.
Autoimmune thyroiditis increases the risk. Okay. But it's generally seen more in females. Like,
Yeah.
what
It's
is the
I'm going
risk?
to give a score for this, but it's more commonly seen in young females. A
Acha,
young
young
female,
females, more common
yeah,
seen.
yeah, young female coming with usually we don't think of malignancy in any usually normal swellings, but if a young female is coming to you hard swelling, you have to rule out papillary carcinoma thyroid, and it's very very common in young females. So that's 10 points for Devang. Debayan, are you ready for your question?
Yes, sir.
Okay, so here you go. Oh yeah, before going to this next question, I'm sorry, Deban. Rohini, can you tell me any other two other conditions with orphan ani nuclei like you see in this photo? Rohini or anyone else can answer the question if Rohini is not available. Again, it's a very important, neat question, so I thought I'll just add it here. Any other conditions with orphan ani nuclei on histopathology? Deban, you want to take a try? Just for knowledge sake.
Not sure. Maybe serous cystadenoma of ovary.
Okay, one. That's one. One more. I think this was already repeat question in my pathology quiz. Very important competitive exam question. You need to know 5 or 6 conditions which are going to have orphan ani nuclei. Okay, since no one is answering, it's going to be papillary carcinoma of renal papillary carcinoma and meningioma, the brain tumor which is going to have this histopathology will be meningioma, and ovarian cancer, like you already told, papillary cystadenoma and papillary cystadenocarcinoma, and last but not the least, in Hashimoto thyroiditis. Okay, you keep this in mind. This might be a potential question for your next upcoming competitive exams. So, Depan, are you ready for your question?
Yes, sir.
Yeah. Twenty seconds.
Sir, I'm ready to answer.
Yeah. Go
Uh,
ahead.
Connect in this case is juvenile nasopharyngeal angiofibroma.
Okay.
The first image basically shows the presence of a mass in the area of the paranasal sign. Basically, there is swelling in that region. The second image shows
What is the specific? What is the? I don't. Actually, this is a specific facies. There's a name for these facies. That's why I put this photo.
frog-like faces.
Yeah. Okay.
Second one shows the Holman-Miller sign or the antral
Okay.
sign. And
Okay.
the fourth image shows the spinopalatine fossa where it is most commonly seen. And
Okay.
the third image, testosterone, maybe it is associated with increased testosterone.
No, I need the specific answer.
Yes, maybe it is used in the treatment of the condition. Not sure, sir.
I'm sorry, Devan, because your time is also exceeded. I can't consider this answer. It is actually testosterone dependent. It's not seen in increase. So it is seen only in males. You can never see this in females. And suppose you see a female coming with JNA, you have to suspect Klinefelter syndrome in this patient. That is why. So basically, in the pathogenesis of the JNA, you will have a vascular nidus of the tumor already present in the body since birth. But once the patient becomes hits puberty, because of testosterone increase in the body, that is going to be the tumor is going to grow. So this is testosterone dependent tumor. So that was the answer I was expecting, Devan. So I'm sorry, but it was a good try, but I can't award you points for this round. So the last question for this round is for Mr. Omesh. Omesh, are you ready?
Yes, sir.
Yeah. So the question goes like this. I need specificity in this round because it's a connect. Okay. B- I'll come back to this question later. Yeah. Here you go, Omesh. I need the answer and why you are connecting to each photo specifically. Last 15 seconds. Last 5, 4, 3.
No, sir.
You don't know? Anyone else? Anyone else want to give it a try? Rohini, first try will be for you. Rohini, you there?
Yes, sir.
Yeah.
Can't
Do you
connect.
want to take a try? Can't connect. Anyone else want to take a try on this?
Sir, I think this is tuberculosis.
Okay. Why do you think it's tuberculosis?
So based on A and D, A it can show the turban epiglottis,
Very good. Okay.
and in D we can see the scrofuloderma.
B.
But I'm
D. Okay.
yeah,
You mean D. You mean in D.
yes, D,
Okay. 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 Okay.
but not sure about B and C.
Yeah. So one important clinical acumen you have to come from get to MB is if you see any patient, have you observed anytime observed two perforations present? See, one peculiar feature about this is you can see two perforations. So basically, I think in OPD you would have seen a single perforation. Usually we see one perforation. If you see more than one perforation in tympanic membrane causing foul-smelling discharge, always think of TB serous media because TB serous otitis media, multiple perforations in a tympanic membrane is highly specific to tuberculous serous otitis media. And see, it is TB, nose TB. Nasal TB is one of the rarest forms of TB. I think it's the, I'm not sure if I'm getting it right, but I think it's the rarest region to be TB affected. Nose and oral cavity are usually resistant to TB. And last one, if you see a sinus, it's actually not, to be more specific, it's a sinus because of TB lymphadenitis. If you see a sinus in the neck, always first think TB and then you go for other causes of sinuses. There are multiple causes of sinuses, but in India, if you see, especially in an adult, if you see any sinus formation or discharging sinus, always first wear a mask because the patient is affected with TB most probably. And A, like you already told, it's turban epiglottitis, highly specific of TB. So this is the end of round three. I'm sorry I'm not able to discuss the extra questions because of the time constraints. Surely we'll discuss these concepts in the further upcoming classes. But because I think TB is important, this could be a potential question. How does sinus form? This stages of TB lymphadenitis is very important. The first stage will be lymphadenitis, just an inflammation. There will be um, discrete lymph nodes. You're going to see multiple lymph nodes, but then stage two, there'll be you'll start feeling that a lymph node, a single big lymph node is present, and there'll be matting. So matting is nothing but a smooth you'll have a smooth on palpation of the swelling, you'll have a smooth feeling, and it's because all the lymph nodes have come together, and there is a periodontitis form. What is periodontitis? The inflammation around the lymph nodes. So because of inflammation around the lymph node, will be adhesion of all the lymph nodes. And stage 3 is cold abscess. So cold abscess is nothing but an abscess formation, but there is no inflammation. Usually abscess is associated with high signs of inflammations like pain, tenderness, and there'll be red skin. But in this abscess, pus is present, but patient won't have pain. So form of cold abscess. Just have a swelling, soft, fluctuant swelling with lots of pus but no pain. And next is cholestered abscess. Cholestered abscess is where this abscess has become diffuse and ruptured, but it's still not come out of the skin. And last stage will be sinus formation, where the rupture of skin is present and sinus pus is coming out. So this could also be a potential question, especially for final years. So this could be, I think TB has no subject. TB is present in all subjects. I think the only concept we are going to read from first year to final year as a main 10 marker is TB. So keep this in your mind. A very important question. So at the end of round 3, the scores are: Debayan stand with 25, Omesh stands at 25, Riya stands at 35, and Dewang stands at 30. So we have come to the last round of this session. Uh, this is go on in 60 seconds. So you're going to have 60 seconds on the clock, and because of time constraint, I think I'm going to reduce it to 40 seconds. Um so we have 40 seconds on the clock, and how many answers? This round is a round for redemption. So each correct answer will give you a fetch of 10 points, and each wrong answer will give you negative of 2 points. So I'm going to dictate the questions, and each person will get one image based answer. So you have 40 seconds. You can take any number of time you want on each question. There are a fixed set of questions. So if you want to pass, you can pass and go to the next question. If you don't know the answer, but
Uh,
I'm not going to say the next question until you going to say the answer or you're going to say next. Okay.
sir, how many questions are there in one set?
Any number of questions you want. There's have enough questions for all four of you. So I in 40 seconds, it's you up to you how many questions you want to answer. Okay. So same question won't be repeated to the same person. Once passed is passed. Any doubts? So if you are ready, can you start this round with Umesh?
Yes, sir.
Umesh, you're ready. So the first question will be image based for all of you. So I'm going to project an image, and once you answer, or if you don't know the answer, you can pass the question. Okay.
Sir, I had a doubt. Like, for the first question is going to go to Omesh. So, like, he's the only one who's going to answer. We cannot answer,
Yeah,
right?
yeah. No,
All
no,
the
no one else can
no,
answer.
we cannot
Only
answer. Okay, okay,
no. It's 40 seconds for Umesh.
okay, okay.
Okay. Just let me set the timer. Just give me a second. Yeah. So Umesh, are you ready? So
Yes,
as soon
sir.
as I go to the next slide, your time is starting.
Okay.
Time starts now. Instrument name.
Sir, this is Ash for.
Okay. Father of modern otology.
I don't know. Pass.
Branch of glossopharyngeal nerve forming over the promontory of middle ear. Plexus over promontory.
Jacobson nerve.
Okay. What is the antral sign on CT scan is seen in which condition?
Uh, Pass.
Causative agent in rhinoscleroma.
Uh, Rhinoscleromas seaberry.
Name the incision used for submucous resection.
Pass.
Other name for Ringer's tumor.
Pass.
Benton Kun criteria is used for.
Allergic fungal sinusitis.
Okay. Pneumatized middle turbinate on CT is called.
Pass.
Which paranasal sinus is developed after birth?
Frontal sinus.
Last. Yeah. So basically, I gave you 60 seconds itself. Let's all do it for 60 seconds because 20 seconds. Let's give everyone a fair chance. So let's go through the questions we asked Mr. Omesh. The first question, the This is actually not Ash forceps. That was a wrong answer. It's actually Walsham forceps. Ash forceps will have a bend at its neck. So, like I already told you, there'll be a class for procedures and there'll be a class for instruments as well. So there we'll discuss everything because again of the time constraints. So there you had a -2 there for the instruments. The second question, modern of the father of modern otology, you didn't answer. So let us. It is Adam Politzer. Okay, so branch of glossopharyngeal nerve supplying, forming a plexus of our promontory is Jacobson's nerve. You already answered it correct. Then antral sign on CT scan, you answered it correct. Bent and Kun sign, you answered it correct. So you have two positives, 20, and two negatives. So you have 16. You have a score of 16. So let's go to our next contestant. Is the next contestant ready? So once the slide is put, your time will start.
Sir, who is the next one?
Sorry, Debayan, are you ready?
Okay, sir.
Yeah. So just a second. Let me set the timer. Yeah, Debayan, you ready?
Yes.
Okay. As soon as the next slide is start, you will going to. So time is going to start. Okay. Start.
Pass.
Diagnostic maneuver used to diagnose BPPV, benign postural positional vertigo.
Epley's maneuver.
Post-oral incision used for ear surgeries.
Lempert. Sorry, Wild's incision.
What is the type 2 Wolstein classification of tympanoplasty?
The graft is placed over incus.
Is IS joint, incudostepedial joint, is ball and socket type of joint? True or false?
True.
Most common organism causing skull base osteomyelitis.
Pseudomonas aeruginosa.
Branch of facial nerve giving taste sensation to anterior two-third of the tongue.
Order tympanine.
Inheritance pattern of otosclerosis.
Autosomal dominant.
In facial polytrauma, zygomatic bone fracture, most common site.
At the junction with the frontal and the temporal bone. Tripod fracture is seen.
Okay, your time is up. You got. Let's go to the question asked. Diagnostic maneuver used to diagnose BPP. You told applies, but it's not diagnostic. It's treatment. Diagnostic maneuver will be Dix-Hallpike test. So you got a negative there. You got the right answer for type 2 Wolstein classification. You told me graft placed over the incus. Post-oral incision, you told me Lempert. So I'm going to give you, there's a -2 for that. Most common organism causing skull base osteomyelitis. Give me the right answer. Pseudomonas. IS joint, incudostepedial joint is ball and socket type. You give me the right answer. Preston. Most common, inheritance pattern for otosclerosis. You give me the right answer. Autosomal dominant. And the last question, most common site of zygomatic bone fracture. You told me frontal and it's not zygomatic bone, right? In facial polytrauma, most common. I'm going to show it to you at the end of the session, the photo. It's a very important
Order
question.
tympani nerve also.
Yeah, one, my bad. Yeah, there's one question. Branch of facial nerve which give facial taste sensation, chorda tympani. So that is 40 plus 40 and -6. You have a score of 36 from this round. So, Dr. Riya, are you ready for your set?
Yes, sir.
Once the instrument is put on the
Sir,
screen, your time will
got
start.
doubt.
Yeah.
What is the instrument? Can you please tell the name?
Yeah, this is called Killian's nasal gauge. Killian's nasal gauge. Okay.
Thank you, sir. Thank you.
Yeah, and this is Walsham forceps, like I already told you. It's not Ask. So, Riya, Dr. Riya, are you ready?
Yes, sir.
Okay. So, once I'm going to put the slide, your time starts. Your time starts now.
Pass.
Most common cause of bilateral serous otitis media in children.
Adenoids.
Pneumatized middle turbinate on CT is called
Concabulosa.
valve at the opening of nasolacrimal duct.
Valva Fessner.
Merciful anosmia is seen in which condition?
Atrophic rhinitis.
Other name for Ringer's tumor?
Inverted papilloma.
Most common virus associated with nasopharynx?
Pass.
Name any one ototoxic antibiotic.
Aminoglycosides.
I need one specific name.
Streptomycin.
What is the endoral ear surgery incision called?
Pass.
Okay. You have your time has ended. So you have 5 correct questions and no wrong answers. So that is plus 50 to you, Dr. Riya. So we have left with last participant of this round. Dr. Dewang, are you ready?
Yes, sir.
Yeah. So once the photo is put, your time starts. Okay. Ready?
Yes, sir.
Name the procedure done.
Posterior anoscopy mirror.
Okay. Which develop first as first symptom in vocal cord carcinoma? Hoarseness of voice or pain?
Forces of voice.
Which fracture most commonly leads to CSF rhinorrhea?
Pass.
Name what is type 6 Wolstein classification?
Sir, that's pass.
What is name 3 structures over the medial wall of middle ear?
Pass.
Most common site of hello. Yeah, sorry. Name the
Hello.
incision. Yeah, name the incision for submucous resection.
Some because that's killers. Killian's incision.
Name the incision for septoplasty.
Freer's incision.
William Wild incision is used for any one surgery name.
Sir, what, sir? Cannot hear.
William Wild incision is used for which surgery?
I cannot get you, sir. Sir, the one question was type 6 sono inversion.
William Wild incision is used for which which surgery? Name any one surgery.
Okay, sir, I will skip the question. Sir, one that question, a type 6 classification, that was sono inversion. Sono inversion.
You have a last question because of the gap in between. What is
Yes, sir.
where is the Woodruff plexus situated?
Sir, Woodruff plexus.
Yeah.
So that's in the posterior part of the septum. That's a venous plexus which bleeds.
Okay. So basically you have 5 correct answers and 2 wrong answers. Woodruff plexus is not situated in the septum. It's present in the lateral wall behind the inferior turbinate, posterior to inferior turbinate. Was supposed to be everyone thinks that it's on the septum, but it's present in the it's present on the posterior surface of the inferior turbinate. So basically, if it's an arterial bleed, that's why it's usually bilateral because little area is on the septum. But if it's a venous bleed, most commonly it is unilateral. Okay, and so that will be a score of 46 points to Dr. Dewang. Let's go through the questions asked for Dr. Dewang. Type 6 Wolstein classification is sono inversion, correct. And name 3 structures. You didn't answer. 3 structures over the medial wall of middle ear. Can anyone answer? It's very important question. Middle wall of middle ear. Name any 3 structures. Anyone? Dr. Riya, do you want to give it a try?
Yes, sir. On
Yeah.
the medial wall, we have promontory, the
Okay.
horizontal segment of facial nerve,
Okay.
then processus cochleaformis, and a bulge for a lateral semicircular canal, oval window and round window.
Yeah, you missed the. And footplate of stapes is present over?
Oval window.
Yeah. So that's end of all 4 rounds. So give me just a moment before I calculate the final scores.
Yeah. Till then, I would like to request our finalists to express their experience. How was the finals? I felt personally the questions were interesting, but the second round was a bit difficult. I felt for a UG, you expect them to know all the steps in that much detail, Dr. Tejas?
Sir, these surgeries actually are asked in Viva, sir. because the tympanoplasty, I specifically kept the tympanoplasty procedure because in my UG exam it was asked to me during the instruments.
Okay, then okay.
So yeah, so I was
Otherwise, the questions were all brain, like a very stimulating type. Okay, in the sense, it's not purely knowledge based, but you have to analyze and then answer. That was my frank feedback. Excellent quiz conducted. Always, our Tejas does better and better every time. His quizzes are always interesting and innovative every time. So, I would like to hear from our finalists. The first, I want to Dewang. Dewang, how was it?
Good evening, sir. Yes, sir. The quiz is actually good. Basically, these questions are something which we do it on a daily basis, but when they are asked without options and in a hurry, then we make mistakes. So that shows that like how rapid we can do this thing. So it was a good quiz. Good questions.
Nice. What about Omesh?
Yes, sir, it was a good.
What was good?
Sir, the same thing the Devang told, sir.
No, tell
If,
two things were good. Tell two things what were what to improve.
sir, first I need to revise the thing. It has been 4 months since
Yeah.
I revised, and the questions were good, sir. It was a clinical based, and especially the connect wala round. So
Anything to improve? You felt quiz was tough or something?
no, sir, it was just means I didn't revise it. I just
Needed one more
came.
revision.
Yes, yes,
Very genuine feedback. Good.
yes.
How about Debayan?
Yes, sir. The quiz was good as always. I have also given other quizzes of White Army, and the quiz is always very interesting. And I would also like to mention that White Army's resources are really very helpful. They actually helped me a lot in my university practical exams. So thank you very much to all the White Army content creators. And I really like all the resources which is being shared on the group. And I look forward to using it extensively for my upcoming entrance preparation. Thank you.
Thank you so much, Debayan. Okay. Riya, would you like to share your experience?
Yes, sir, it was a really good quiz. All my concepts were brushing up as I was going
That's what I told in
further.
the beginning, right? Tejas will make sure that he wants to teach through every
Yeah.
question. He will make sure that entire topic is covered, not just he'll ask one, he'll put a worm inside your brain, not like that. He'll make sure that then and there itself is that the entire in and around all the questions are covered, entire topic is covered,
Hmm.
each question. So, how was it? It was tough, medium, or easy?
It was easy, medium, as well as something which I didn't know. So it was a little tough for me because I needed to revise more.
Hmm. Happy?
But also I learned many new things. So it was really good experience.
Thank you. Rohini, are you there? Rohini, she left this thing?
and she's not there, sir.
Okay, and KP, our next quiz finalist, KP. KP is our next quiz finalist.
I think Dr. Adishesh answered a lot of
Yeah,
questions.
he did really well. And the Tejas, there are so many, more than 150 members are seeing live on YouTube. Especially Krishna, what is Priya? They were answering really well. They answered most of them. Vijay Lakshmi and one more was Atharva Patil. They answered everything. All of your questions were answered by them so well. So I would like to give them also a big round of applause. And KP is unable to mute himself. I'll just check with KP. KP left this thing. Okay, Adishesh, you want to comment something?
He is also not there, so no.
Adishesh also not there. Okay, anyway, fine. We would go with the results.
Yes, sir. So actually, everyone were very close until the rapid fire round. So rapid fire round was actually to just people who could like it's a spontaneity. So I think everyone needs spontaneity in life. So based on that, there were differences made based on the last round. Until then, everyone were actually, I think, very close. So in fourth
Fourth
place
place.
we have Mr. Omesh
Oh, nice, nice. Without preparing
with,
anything,
with
he has done
41
so well.
points.
Excellent, Ramesh.
In third place, we have Dr. Debayan, 61 points.
Oh, great, great.
And in second place, we have Dr. Dewang with 76 points. And first place goes to Dr. Riya Gohil
Oh,
with
really?
55 points.
Oh, nice, nice, nice.
Last minute into the quiz.
Congratulations, Riya. And now I would like to Umesh.
Thank you, sir.
Umesh and Debayan, you will learn everything from Tejas himself soon, okay? In your postings, or he's also from Sage GS, if you don't know. Okay, I didn't reveal it at the beginning. Uh, you will learn more. Okay, Umesh, when you go to internship, catch hold of him. Okay, you will he will teach you everything. By then he'll also be final year. Debayan, you are also from Sage GS, right?
Yes, sir. I am intern.
Okay, you are not yet finished with the ENT.
No, sir. It will just next month it will start.
Then soon you will be okay. You will learn from here. Okay, the quiz master himself directly there. Okay. Anyway, Riya, excellent. All of you have done well. Just like my quiz master mentioned, all of you answered well. I really wondered our knowledge when compared to our time. You people's knowledge, that the spontaneity, what he was telling, analytical skills, everything is next level altogether. All our five finalists were too good. That's what I felt. You people have a very bright future ahead. Take up the spirit and continue the same zeal. Okay, in the coming exams also. This should motivate you a lot. Without any preparation, see, I announced in the last moment, just 4 5 days back. I announced the quiz, and you could not prepare anything amidst your busy internship. Even then, you gave the prelims, did so well in the prelims and in the finals also. The way you were answering, because quiz master was really tough. He was asking the in and out. He was not just expecting the answer. He wanted you to know in detail the entire concept. So even then, you answered really well. That really shows how strong your basics are, how much depth you learned. Excellent, excellent performance. I'm not just exaggerating, but really I felt so. Thank you so much. And once again, the one of the best shows put on in our EPIGNOSIS so far by Tejas. All three quizzes he did really well. One is better than the other. And even I was so busy with some other thing, but even I sat back in the entire quiz because even I could learn so many things from him. Every time I take this opportunity to learn from Tejas. He makes the subject very interesting, and the way he explains also very well. Very well he explains. Thank you so much. Please continue to take many more classes for us, Tejas, at your convenience, and looking forward to have many more quizzes from you and our members also. Please, as and when you're free, see, we have done something for you. You also should continue this. Okay. Tejas once used Vaishnavi resources for his preparations. Now he himself is the mentor now. Similarly, I expect Debayan, Dewang, everyone to come up. When you finish your final year internship, then you should take classes for your juniors. So this knowledge should pass on. Okay. Thank you so much for all the active members for the continued support and cooperation. Let's call it a day. Thank you.
Thank you, sir. Good night.
Thank you, sir.
Thank you, sir.